Today we will discuss about spleen. Introduction. Spleen is a lymphatic organ connected to the blood vascular system. It is wedge-shaped. Location. It lies mainly in the left hypochondrium and partly in epigastrium. It is wedged in between the fundus of stomach and diaphragm. It is tetrahedral in shape. Dimension. The spleen is 1 inch thick, 3 inch broad, 5 inches long, 7 ounces in weight, and related to 9th to 11th rib. These all are odd numbers, so you can remember this easily. The spleen is not palpable. Position. The spleen lies obliquely along the long axis of 10th rib. It is directed downward, forward, and laterally, making an angle 45 degree with the horizontal plane. This is the axis of spleen and this is the horizontal plane. So this angle is 45 degree. External features. The spleen has 2 ends, 3 borders, 2 surfaces, 2 angles, and 1 hilum. 2 ends. The anterior or lateral end is expanded and is directed downward and forward. The posterior or medial end is directed upward, backward, and medially. 3 borders. The superior border is notched near the anterior end. The inferior border is rounded. The intermediate border is also rounded and directed to the right. 2 surfaces. The diaphragmatic surface is convex and smooth. The visceral surface is concave and irregular. 2 angles. The anterobasal angle is the junction of superior border with the anterior end. So this is the anterobasal angle. It is also called as clinical angle of spleen. The posterobasal angle. It is the junction of inferior border with the anterior end of spleen. Hilum. It lies between the superior and intermediate borders. It is a splenic hilum. It is pierced by branches and tributaries of splenic vessels. Peritoneal relations. The gastrosplenic ligaments extend from hilum of spleen to the greater curvature of stomach. It contains short gastric vessels and associated lymphatics. The leniorenal ligament extends from hilum of spleen to the anterior surface of left kidney. It contains the tail of pancreas, splenic vessel, and associated lymphatics. The phrenicocholic ligament is not attached to the spleen but supports its anterior end. Visceral relations. The gastric impression is for the fundus of stomach. The renal impression is for left kidney. The cholic impression is for the splenic flexure of colon, and the pancreatic impression is for the tail of pancreas. Arterial supply. The spleen is supplied by the splenic artery, which is the largest branch of celiac trunk. Venous drainage. The splenic vein is formed at the hilum of spleen. Its tributaries are pancreatic vein, short gastric vein, left gastroepiploic vein, and inferior mesenteric vein. Lymphatic drainage and nerve supply. Splenic tissue has no lymphatics. A few lymphatics arise from the connective tissue of the capsule, including trabeculae, and drain into the pancreaticosplenic lymph nodes. The nerve supply. Sympathetic fibers are derived from the celiac plexus. They are vasomotor in nature. Clinical anatomy. Palpation of spleen. A normal spleen is not palpable. The spleen becomes palpable only after it has enlarged to twice its normal size. Splenomegaly. The enlargement of the spleen is called splenomegaly. Splenectomy. Surgical removal of spleen is called splenectomy, as you can see in this figure. Splenic puncture. When enlarged, spleen can be punctured using a lumbar puncture needle.